Madam Chair, committee members, thank you for the opportunity to talk with you this afternoon about critical issues of uninsured children in Texas. I'm Executive Director of the Children's Defense Fund here in Texas. I love my job. I love Texas. I'm not a native Texan, but I am very concerned about the state of our children and our health care in Texas. So I am appearing supporting Medicaid expansion to the Bill 3376 as presented by Representative Turner. I am understanding that the name of this bill or the program or the specifications may change, but I think the principles are really clear, and those are ones we would like to support. Children's Defense Fund, some of you may know, we are on the front line not as a direct service organization, but as an advocacy organization for children. Our primary health care work is really about this business. We are enrolling children in Medicaid and CHIP. We have been doing that for 15 years. We are in the face of seeing the impact of what happens to families. You've heard several families present before you today with very compelling stories about the difference that health care insurance has made to them. What I'd like to do is not repeat what others have said, but perhaps illuminate a couple of points that are specific to children that may be helpful. We're supporting this bill primarily because we believe that extending Medicaid coverage to include adults who are low income makes absolute sense. I think the issues surrounding why are there adults who cannot get health insurance was illuminated this morning regarding some of the reasons that occurs. But in fact, we have 2.6 million children on Medicaid currently, and you might be surprised to know that only 9% of the parents of those children have insurance. And so somewhere we've missed the boat, and it goes back to the issue of why are some folks not able to get insurance. And so the premise really is that children do better, and we have evidence of this, when they're in families where they are insured and their parents are insured. Part of the Medicaid expansion offers a chance to enroll 1.1 million adults, and we believe that children in families also get enrolled. And we have some research that supports that children in families where parents are insured, it makes logical sense, are more likely to be insured. We've had some discussion about the distinction about actual health status of children who are insured versus children who are not insured. And so we know that children who are insured get more checkups, they get preventive care, they get dental care. If their parents also are enrolled, they actually stay enrolled, which is a big factor here in Texas because we have a 6-month enrollment and renewal process. So what we are asking is with the Medicaid expansion and the opportunity for the welcome mat, this presents an opportunity not only to enroll 400,000 children, but also to extend coverage to low-income adults. Do I have 15? Am I done? I am. I'm sorry.
Ask the question. The Medicaid expansion includes adults with children and adults without children. And we have income eligibility and rules for those same parents, because they would be parents of children that would be in the Medicaid program. What do you which rules do you think would apply if under 100% of poverty, there are no the assets tests exist or don't exist, depending upon where we are. Next year we won't have assets tests, but right now with the adult requirements, if we had assets tests or other things, would that supersede the requirements for children? And this is, an interesting thing because people like to talk about the Medicaid expansion as childless adults, and it's not all childless adults. So could you talk about that and some other things that you didn't get to?
Ooh, a little bit of license. Thank you, Chair. I think the issue from my perspective, and I am clearly biased, we are about kids, and so that's the lens that I'm trying to provide today. So that would be my primary interest, and that is because this is our future. We cannot afford to lose more decades. Our children are our investment in the future, our economic viability, and we have to make some decisions to do the right thing. We have missed the boat a number of times. It's not okay to be behind because the people behind are our children. And so we have a tremendous opportunity, whatever the decision looks like, to be able to make some change and turn this around for families at risk and in particular children. So I'm not sure I specifically answered your question, but through the lens of children, that would be how I would see that.
Good enough.
Thank you.
Thank you so much.